just stood, it's fine. Second. Would you please welcome Wayne as he comes forward? This is actually, give him a round of applause. This little video we wanted to see first, I have to bring up. Wait. Relax. See, turn around and look backwards.
Today's topic, how does health insurance work? The simple answer is, it's about economy of scale. Since time began, mankind has found safety in numbers. Health coverage is no different. When you sign up for coverage, you join a group of other people to combine your healthcare purchasing power. Your insurer covers the whole group rather than individuals, so everyone shares the cost of staying healthy. It's a lot like an auto insurance company that collects premiums from its customers, then uses that pool of money to pay accident claims when a customer has a wreck. Here's an example. Gary's a healthy guy, but it's his first time skiing. Moments after stepping off the lift, he plummets down the wrong slope and hits a tree. Then 5 more trees. Then he slides over the edge of a small cliff and is promptly hit by a falling safe. Just then, his wife calls to inform him she's about to deliver twins. Gary's about to be buried under a lot more than snow, because costly medical events like these can be devastating without health insurance. His broken leg and concussion can cost thousands to treat, and depending on the circumstances, the birth of his twins could cost anywhere from a few thousand to $100,000 or more. Fortunately, Gary has health insurance. Remember that you spoke of? Since the cost was spread out over everyone, people in Gary's group were actually helping to offset his costs. Gary's going to pay a lot less to treat his injuries and deliver his kids because his insurer is betting that the money the group pays in will offset the total costs of their health expenditures for the year. In a sense, the healthy people in the group help pay the costs when someone is sick or injured, knowing that the same help will be there when they need it. So instead of paying thousands of dollars, Gary's out-of-pocket costs are minimal. He's only responsible for his copay and his deductible, which vary by insurer. So to sum it up, health coverage reduces your risk of financial disaster because your health costs are spread across a large group of people, and the healthy people help pay for the sick. So now you know. Until next time, stay smart and stay healthy.
That's the marketing. You see it all over. Did you notice that it said that you might not be able to get care because care is so expensive without health insurance? Did you also notice that it said that somebody with health insurance will have to pay a minimal copay and deductible? Not thousands of dollars? I'm not going to read the details up there, but that's been my experience, my daughter's experience, about how the system treats people. We have animal rights groups out there that protect the rights of animals more than some of the people are protected in our healthcare system. And I just need to add a little disclaimer here today. Last week I talked about some of my background and some of my experience and some of my education and about the hours that I put in. The only thing I didn't say was, that doesn't make me an expert. Because what happens when you get a bunch of experts in a room? Probably not much. This also has not been what I would call a great week this week. Tuesday, my daughter saw the therapist here in Beloit. When I picked her up, the therapist had recommended that she see a doctor today. That was on Tuesday. Now, the only place you're going to get in on that day is at the emergency room. So we made the trip to the emergency room. They added another medication. They wanted her to see her GP. So this triggered a visit to her doctor on Thursday. And while she was in the emergency room, I finally went to fill the prescription for the pain medication that she ran out of on Tuesday morning. And by the way, for those that haven't been involved in buying those kind of medications, they cannot be transferred electronically. You have to go to the healthcare facility and physically pick up the prescription. You have to deliver it to the pharmacy. So somebody has to do that running for the person that has the injury. I went to pay for the prescription, and the copay is supposed to be $10. The bill was $79. I said, what about the insurance? The insurance had been canceled as of August 13th. Now, my daughter has been proactive in this process because she's been covered under FMLA, which is continuation of employer coverage, Family Medical Leave Act. She asked the employer when that coverage was going to terminate. They told her at the end of August. She sent the money to the employer, her portion of it, for coverage for the full month of August. As of this point, no refund has been made for that 1.5 month, for that coverage that was denied. She talked to the benefits. She tried to get a hold of the employer, and they were pretty busy. And it came down to the fact that this is a private sector corporation in the healthcare industry whose benefits administrator is located out east. The benefit administrator is working on the paperwork for the new benefit year that starts October 1st. She didn't have time to take care of the mistake that was made dealing with the COBRA extension for my daughter. And when you talk benefit year and copays and deductibles out of pocket, the marketing says minimal amount. The policy for my daughter is $11,100. Maximum out-of-pocket expenses, and for somebody with a chronic condition, they will meet that each and every year, and the only income is a temporary disability policy that pays $1,200 a month until the middle of November. I'm going to say something from this article about $750 billion in waste in the healthcare system in America. $750 billion is more than the defense budget. If banking worked like healthcare, ATM transactions would take days. Think about that. If home building were like healthcare, carpenters, electricians, and plumbers would work from different blueprints and hardly talk to each other. What kind of a house would you get? What kind of a house would you end up with? If shopping were like healthcare, prices would not be posted and could vary widely within the same store depending upon who was paying. If airline travel were like healthcare, individual pilots would be free to design their own pre-flight safety checks or not to perform one at all. The outsourced customer service center for the private sector company, and it's a well-known company, ADP. I've got really no gripe with ADP except their customer service center. It's very difficult to understand what they're saying. There's a communication barrier. But my daughter was on the phone with them, and they were trying to lay the blame for the mistake on her, which is somewhat prevalent in the healthcare industry. They try to blame the patient. They look everywhere else except for themselves, except in the mirror to assess blame. Wednesday night, neither one of us slept very well. Nikki's in pain. And I don't know how many people have been in healthcare facilities. You have these signs posted all around. You have the right to adequate pain management. You have the right to. Guess what? For those that really need it, because of the trend in the medical field right now, actually what you end up doing is a form of torture. You will get some pain medication, but you will not, I'm not sure on this percentage, but there are a number of patients, somewhere in the 20 to 30% range, that do not receive adequate medication for their pain. The other worry was, and there was no written notification of the cancellation of this insurance policy. That was found out at the counter, at the pharmacy, when you went to pay for the prescription. Nikki was still in pain on Wednesday night. There was also the additional worry, would she be seen by the doctor the next day, or would she be denied care? They had tried to deny it once before, but they had done the surgery on her hands. And the only reason she got in to see the surgeon to follow up there is because that facility had done the surgery. They have to make sure that everything went right because they have some liability. So would she be seen? I stayed awake most of Wednesday night because she was up and down. And I was wondering, were we going to have to make a trip to the emergency room again on Wednesday night? Thursday morning, and I may have this timeline off just a little bit, but she talked to the benefit administrator and they told her that she could pay online. So she went online to pay and they would instantly update the records so that her coverage would be reinstated. Well, the online payment system wasn't operating correctly. Technology. Or excuse? Who knows? You're not there. So, it was a trip to get a certified check because I advised my daughter that she hadn't better just send a regular check. Because the next excuse was, we're not going to be able to update your records until the check clears. Well, certified funds are the same as cash. So trying to be a little proactive there. Send it next day air. That's another $20. Wow, $18.95. For somebody that's not getting what does that do for access to health care? She was seen on Thursday. On Friday, she checked the temporary disability website and the status on her payment that for the first 2 weeks of September still was pending. She called the company and they said, well, we're waiting for medical records. Now that authorization to get those records was faxed to them at the end of August or at the very latest, the 4th of September. They hadn't gotten medical records yet? Nikki called the healthcare provider, the medical records clerk. Had not received a request for medical records yet. That's still open and pending.